The goal of the Pelvic Health Center is to provide coordinated, compassionate care for individuals with different pelvic health disorders. As a team, we want to take care of the individual, and each of us comes with a specific specialty, and our goals are really to help someone be able to discuss their symptoms, test for them, and then come up with a treatment plan, and ultimately a better quality of life. We see both men and women, and people of all ages. It's really for everyone.
Sometimes it's hard for me to realize that this little body of mine needs more than what I can give it alone.
When I first met Connie, she was in a situation where her pelvic health needed immediate treatment. And her Stanford doctor knew who to call, knew what team to put together to give her that immediate treatment she needed, but also to set her up for the long term.
She took all the time she needed. Then she asked me some questions and talked about some options. And then it was very much up to me to say, well, I'm comfortable with trying this.
Over time, we've treated Connie's pelvic conditions, and then new conditions have arisen. And at each step, Connie and I sit, we talk about the options, about her lifestyle and her goals, and at every stage, we've decided on what treatment is right for her in that moment.
Yeah, I know you're excited.
Some pelvic floor strengthening exercise, Martha, we're going to do is you breathe in and letting everything slow down.
It's very important that we're taking a holistic approach. We have our pelvic floor physical therapists, we have our nurses, we have our medical assistants. Some of us are surgeons and some of us manage things medically. And so we have all of the treatment options available to us.
This is a really unique situation that we can work alongside with other colleagues and address all these problems in one clinic.
The benefit for a patient to come to a multidisciplinary center is so that you can speak directly to multiple specialists at the same time. What we want to do is look at the individual patient, to look at your chart in completion and think about which specialists are right for you to meet and talk with. When I look at Connie now, compared to when I first met her, it gives me immense satisfaction to see someone come to a place where I get to hear about her swimming, about her travels, about the fun that she has with her children and grandchildren. It just absolutely reestablishes my love of medicine.
If I know my body is well enough to be able to swim, then I know that I am. And every time I get in the water, then that's an affirmation of life. It has helped my sense of well-being. I'm grateful. I am grateful for life.
This was a terrific opportunity in a brand new facility to take this idea of bringing all these specialists together and create better patient outcomes.
Pelvic health is really the cornerstone of you achieving the kind of life you want at any age. To be in a place like Stanford and to have access to multiple specialists all together who are actually sitting down and talking about your customized treatment plan, that's what healthcare should be. That's what it's all about.